want to thank you all for coming out today. And that we're here. This is one of the greatest tragedies I think of our time, by and large, right? Unfortunately, we're not able to notice what's happening underneath the surface, and what's happening underneath the surface is some of the most vulnerable amongst us are suffering, right? And they're dying, and it's hard to provide them access. Anyway, welcome. My name is Mark DeCluett. I'm a psychiatric nurse practitioner. I work at a behavioral health clinic in Alexandria and Lafayette, Louisiana called Access Behavioral Health. And every day we're providing care to this vulnerable population. We are very thankful to Governor Edwards and his administration for leading the way in providing increased access to care. It started with Medicaid expansion and continues with this proclamation. It's hard to get a current with what's happening in this day and age, right? COVID is always on the forefront, telling us we need to put on masks, we need to do this, right? When what we do, right, is try to connect communities and try to bring people together so they can begin to heal, right, and begin to realize the best versions of themselves. And to do that during an epidemic that prevents us from gathering is challenging. I thank you all for coming out today. We have brought a number of professionals in the community to give us kind of some pinpoints as to where we are and where we're going with treatments, what needs to be done, and we're hopeful that this platform that we've been afforded allows that to happen. I want to kind of point out a couple of quick stats before we kind of get the proclamation going and get the event underway. You may have noticed in the past couple of weeks, a number of publications have highlighted that the number of deaths related to opioid-related overdoses have increased dramatically in the country. I think over the past year, there's been a 30% increase in opioid-related overdoses in the country, right? And that pales in comparison to the number of overdoses we've had here in Louisiana in terms of the jump, right? We've seen a nearly 50% jump over the past 12 years, and it's the greatest jump we've seen since 1999. With that being said, I think in my community of Lafayette, we've had a greater than 60% jump, and we ask ourselves, why is this happening? Like, why can't we provide, I think, a level of care that keeps people alive? And it's for a variety of reasons, but I think on the top, it's that we're seeing a higher potency of drug enter the market in the system, and it's an unintended, I think, taint with fentanyl that's killing people, right? While at the same time, they cannot simply access care, right? We can't get it there. And so, again, I want to thank you all for being here. Let me introduce them. Excuse me, it's a little hot out here, right? But Ms. Juanetta Womack, Director of Clinical Adult Services for the Office of Behavioral Health and LDH. Come out. Thank you, Ms. Juanetta.
Thank you, Mark. Thank you all for coming out today. I would like to read the governor's proclamation for today. Whereas nearly 40% of the 1,140 reported drug overdose deaths in Louisiana involved opioids in 2018, a total of 444 fatalities. And whereas overdose deaths rose by 42% since 2019, according to research done at UCLA, examining near real-time data from about 90% of U.S. emergency medical service calls. And whereas in Louisiana, overdose deaths have jumped 50 to 75% from 2019 to 2020, the largest increase in the country. And whereas around 70% of overdose deaths involve opioids, meaning opioid-related fatalities outpace firearms and motor vehicle deaths. And whereas Louisiana in 2020 was the top state in drug overdose growth during the COVID-19 pandemic, according to information from the CDC. And whereas Louisiana is in the top 10 for predicted overdose increase from May 2020 to May 2021 at 48%. And whereas prevention, intervention, treatment strategies, and recovery support services should be implemented in tandem to reduce opioid abuse and overdose. And whereas Louisiana citizens now have access to resources for help in each parish, text the keyword opioid to 898-211 for resources in your area. Again, that's opioid to 898-211 for resources in your area. Now, therefore, I, John Bell Edwards, Governor of the State of Louisiana, do hereby proclaim July 28, 2021 as Opioid Crisis Awareness Day in the state of Louisiana. And on behalf of the Louisiana Department of Health, Office of Behavioral Health, we are dedicated to providing intervention, prevention, treatment, and recovery support services to address the opioid epidemic here in Louisiana. We are partnering with federal, state, and local communities to create a strategic plan to provide and ensure that treatment services are available within our state. We are implementing a multifaceted approach because we know this is indeed an epidemic and that we have to implement traditional and non-traditional approaches to engage persons into the treatment array of services that we have available here. And we want you all to know that if you want more information about resources available in the state of Louisiana, you can go to opioidhelpla.org. That's opioidhelpla.org to receive more information about the services we have. We are expanding access. We are increasing capacity across the state to ensure that people have access. People that are suffering, families that are suffering from the opioid epidemic, we want you to know that we are here to help. We are here to provide services. We are here to provide intervention, prevention, treatment, and recovery support services. Reach out and someone will be there for you. We will be there for you in your time of need. Thank you. Quinetta Womack, Office of Behavioral Health.
Thank you, Ms. Womack. Next, we're going to have up Ms. Lily Harvey. She is a tireless advocate for those suffering from opiate use disorder. She's doing remarkable things, helping, I think, bring attention. Ms. Harvey.
4 years ago, I received a phone call that no parent expects. My youngest daughter, Millie, was found in a park in central Louisiana, unresponsive. I rushed 2 hours to be at her side. When I arrived at the hospital, I saw a beautiful 28-year-old girl on a ventilator. Her hair and her skin was perfect. Her fingernails were polished and perfect. But there was nothing perfect about this situation. The doctor came and informed me that it was a fentanyl overdose and the outcome wasn't going to be good. Overdose? My daughter didn't have an opioid problem. Why, God, this should have been me. You see, at the time it happened, I had just completed a 7-month rehab in Winsboro, Louisiana called Fresh Start, and I was in an internship in my 3rd month. Because of years prior, I had a disease with my muscles in my neck, and I had developed an opioid addiction. When I couldn't get the amount of pills that I needed from my doctor, I took to the street. I once had a career as a nurse, but opioids stole my nursing license. Opioids stole my marriage, my relationship with my children, and my family. And I found myself homeless on the streets in South Louisiana, living out of my car looking for my next fix. Within a year of street life, I had landed myself a temporary residence called Ashland Jail, where I did almost a year. But now, on this day, a decision had to be made. So Millie's father and I signed to take her off the ventilator. Opioids had now stolen the life of my youngest daughter. On February 14th, Valentine's Day, on a day of love for a girl who was so full of love, we memorialized her at a home church in Catahoula Parish. Her death rocked our small, close-knit community. Afterwards, I tried to reach out to others who had lost ones the same way as Millie. I knew there must be others that were going through this, but there was no advocacy. I felt God calling me to make a difference. So August 18th, I held my first Millie Mattered Overdose Awareness Day in the same park in Alexandria where my daughter was found. A few families and friends came out and brought pictures of their loved ones. I believe I collected probably 11 faces that were gone too soon that day. From that day forward, I have never let up. My second overdose event in 2019, I had 5 banners on display from a group called Can You See Me Now? Those groups were led by Stacy James and Tracy Carter, 2 mothers out of Arkansas who lost their sons, Hagan and Trey, to opioid overdose as well. What an impact it was when people came and saw 750 faces compared to just the 11 the year before. This year, I will hold my 4th annual Overdose Awareness Day. Unfortunately, I will be displaying 3,600 faces, and 80% of those are opioid related. The crisis is affecting the state as a whole, and I had to find a way to reach more. In 2019, I met a lady called Debbie Nadler of Las Vegas. She had a vision to hold awareness walks in every state across the country. She lost her son Brett at the same time I lost Millie, also to an opioid overdose. She asked me to be the coordinator for our state. This past March, I host walks in West Monroe, Winsboro, Alexandria, and Lafayette. The response was better than I expected. Over 500 people came to walk. Debbie wanted to make the walks a little bit more personal, so for each state, she created a banner to represent the people that had gone in our state. Along with the banners of Can You See Me Now, we grabbed attention of local news outlets and shared much needed conversations in our state. Mothers came out and talked about their children, their families. They felt comfortable for the first time being around others that had experienced the same as them. These families face so much stigma. It's hard for them to come forward. The faces on the banners, though, you can see, they look like you. They look like me. We're just a handful of grieving mothers who are trying to put out hell with a water gun. And with God's help, we're building an army. And we will fight on. Thank you, Mark. Thank you, Jan. Thank you, Governor Edwards. This is huge for advocacy. Millie mattered, and so did the thousands of lives that have been lost in this state to the opioid crisis.
My performance will be that much greater now, so here we go. Something that struck me, I think, during her presentation, diving into some of the data coming into this, is the number of youth and middle age being affected by this epidemic, right? Overwhelmingly, people who are overdosing and dying are between the ages of 36 and 42, and over the past year, it's probably over the past year, I think it's a week doesn't go by that, whether it's in the hospital or in the clinic, that we're hearing a story about that. Whether it's unintentional or intentional, but it's people are dying and communities are hurting. And so Well, we appreciate the efforts you're putting forth in bringing people together, because they only want to be seen, right? We want to be seen. We want to be able to have a conversation with the community at whole, and I think that's what we're asking for today. So thanks for coming out again. Next, I'd like to have out Ms. Reagan Carr, who's joining us from the Louisiana Primary Care Association. She sits and oversees the Health Policy and Governmental Affairs Division. Thank you.
Good afternoon. Thank you all so much for having us. My name is Reagan Carter. I'm the Director of Health Policy and Governmental Affairs with the Louisiana Primary Care Association. LPCA is the member or trade organization for the federally qualified health centers here in our state, also known as community health centers. Right here in our state, we have 39 organizations that operate over 300 health centers in our state. We recently received an opioid communities response grant from HRSA for a total of $1 million. We are focused on prevention, treatment, and recovery here in our state. And we know that we need partners like everyone here to be able to do the work that is so important to our state. The COVID-19 pandemic has taught us a lot about services and healthcare here in our state, and it has also taught us the importance of making sure that behavioral health services are available. The Louisiana Primary Care Association members served over 465,000 patients in 2019. We fully expect that that number will have increased for 2020, and of those services, about 10,000 of those services included behavioral health services, also included substance use. We know that in Louisiana we are in the middle of an opioid crisis. We know that the pandemic has isolated many of our people here in our state, some who were already in crisis and some who may not have been able to fully understand what's going on and further isolated themselves. And so we are here as an organization. We thank the governor for having this awareness day. We thank 211, who invited us here to participate, and we are committed to being a vital part of the healthcare system to make sure that opioid epidemic is dealt with here in our state in a way that is loving and caring part of the people of our state who deserve the services. So again, I'm Reagan Carter with the Louisiana Primary Care Association. We're happy to be here. We're happy to partner with everyone. Please reach out to us if you need our assistance. Thank you so much.
Thank you so much. Next, we'll have on Dr. Christopher Rajman, board-certified psychiatrist and addiction specialist operating out of Central Louisiana. Dr. Rajman.
Good afternoon, everybody. Thank you all for the opportunity to be here today. My name is Christopher Rajman. I'm an MD, and I'm board certified in psychiatry and addiction medicine. I'm the Associate Medical Director of Longleaf Hospital, the Medical Director of the Longleaf Hospital Intensive Outpatient Program, and the Medical Director of Access Behavioral Health and Recovery. And I am a staunch, unapologetic advocate for medication-assisted treatment and the mass distribution of Narcan. First, I'd like to thank Governor Bell Edwards. Allow me to thank you for your advocacy for the mentally ill and the substance dependent. Your decision to expand Medicaid has unequivocally saved thousands of lives and is the one single action at the state level that has allowed us in our clinic to do what we do for the people of Louisiana. I'd like to thank Longleaf CEO Claire Hick for advocacy for these patients, and our clinical director Candace Blood with her experience in outpatient clinics for helping make this possible. I'd like to thank our partners at Access Behavioral Health and Recovery, Mark DeCluett and Cynthia Beverly, and our staff for their tireless efforts to help fill the medication-assisted treatment void in Central Louisiana. I'd also like to thank Dr. Jay Pyland and Dr. J. David Hammond for mentorship in this and other areas. Medication-assisted treatment with medications such as buprenorphine, methadone, and naltrexone is expanding in Louisiana but has a significant way to go. A lot of these treatments, specifically the opioid agonist treatments, methadone and buprenorphine, are highly stigmatized, specifically in Louisiana, even among healthcare providers, pharmacists, and family members of opioid-dependent individuals. Methadone is a wonderful treatment. There are Vietnam veterans alive today who first started using opiates in the 60s because of methadone. In every sense of the word, that is a win. While methadone is a great treatment, it tends to be highly regulated and is therefore difficult for us in private practice to prescribe. What we focus on and what primary care providers all over the state can do This is what they can do to help with the opioid epidemic, is to become waivered and begin prescribing buprenorphine. I tend to find that if people understand how it works and hear just how well it works, how safe it actually is, even the greatest of skeptics can come around. Buprenorphine is what's called a partial agonist, and as such, it binds tight to the receptor in the brain. It will knock anything else off. This will also work in an overdose. You can take this and it will knock what you have on the receptor off, and it will work. Because of that, when using it, if people take other opioids on top, it will block the effect. Buprenorphine has what we refer to as a ceiling effect. Once all the receptors are capped, you can't get more. So there is a maximum dose that people can receive. Patients do not feel intoxicated. If you take just the buprenorphine, it is essentially impossible to overdose if you are opioid dependent. Overdoses only occur when other medications are put on top, such as Xanax. The whole point of this medication is to make cravings and withdrawal stop so that someone can go about their day, take care of their kids, get a job, finish school, etc. Become productive members of society again. Opioid withdrawal and cravings are, from what I have heard, the worst feeling in the world. This makes it stop and makes it stop safely. Withdrawal and cravings are what causes family and healthcare workers to become jaded and hardened to people with substance use disorders. It's what causes bad behavior in the ER. It's what causes people to lie, cheat, and steal. Opioid withdrawal is so scary that someone will use a dirty needle to avoid it. Buprenorphine prevents all of this. It comes in safe formulations such as Suboxone that prevents misuse, and long-acting injections, where you get an injection once a month and you have a full month's supply of the medication, and that way it can't be diverted. Scientifically, make no mistake about it, this is nothing short of a miracle drug. But don't take my word for it. Studies are clear that this is an incredibly potent and effective treatment for the opioid-dependent individual and can keep people both alive and productive. Kako et al., the first major study looking at one-year retention and treatment with opioid-dependent individuals in 2003, showed that at the one-year mark, 75% of the patients on buprenorphine stayed in treatment for a full year. If you have any experience working with substance use disorders, 75% retention is absolutely incredible. Alternatively, 100% of the people in the placebo group left treatment by day 50. Let me repeat that. 100% of the opioid-dependent patients not given buprenorphine left treatment by day 50. Worst of all, the investigators had to emergently stop the placebo arm of the trial because 1 in 5 patients died. Study after study has demonstrated the potent efficacy of buprenorphine in keeping opioid-dependent patients alive. Wakeman et al. In the Journal of the American Medical Association in 2020 assessed the comparative effectiveness of different treatments for opioid use disorder, and only buprenorphine and methadone were shown to keep opioid-dependent people alive and prevent overdose. Not inpatient treatment, not rapid detox, not intensive outpatient treatment, not naltrexone. Only buprenorphine and methadone. In 2021, again, in the Journal of the American Medical Association, Santo Jr. et al. Completed a systemic review and meta-analysis of all-cause mortality with opioid treatments with buprenorphine and methadone. It showed reduced mortality from all causes, heart disease, cancer, all causes, for patients who are on these treatments. Most encouraging, and what should galvanize primary care providers to get involved, are what we call the Big Four studies, which demonstrated that a simple, brief, sit-down session with a provider combined with a buprenorphine prescription has been shown to be more effective than insisting a patient do psychotherapy along with buprenorphine. A simple sit-down interview in any doctor's office along with buprenorphine can keep people alive. When we began this journey 3 years ago of mirroring programs in other states, starting patients on buprenorphine and keeping them on it, we had no idea how it would flourish. Now, local treatment centers maintain buprenorphine on patients. Local DHH facilities are beginning to offer it to their patients as well. There is a light at the end of this tunnel, but it requires all of us at all levels, from family members to clinicians, to change the way we look at this problem and open our minds. The tide is turning, and we can win this. Thank you.
Test, test, test.
Thank you, Dr. Rajman. I kind of echo some of those sentiments and what we began 3 years ago, and I think providing buprenorphine to members of the community in Central Louisiana, right? Like what began as something that was keeping people alive and getting them to work the next day, to take care of their kids, right? built slowly upon itself. And right when the pandemic kind of came and hit in central Louisiana, Alexandria, there was this beacon, right, where people can come and fellowship and like lean on each other during tough times. And that's what like Louisiana is all about, right? Louisiana is about like neighbor and community, and at its core tenet, that's what recovery is about. Like, and it's amazing what COVID has done to that. But at the same time, I think there's the testament to our clinicians all throughout the states, what we've done to try to keep that line of communication open and keep people, I think, just engaging. That's the challenge. One of the things Dr. Osmond didn't mention is the difficulty in prescribing that medication at large amounts, right? That we're capped, and so all of a sudden we have to turn people away at the door because we're only allowed to treat so many. So I encourage primary care providers, any kind of provider in the community who wants to contribute to step forward and get waivered, because that's kind of where it begins. With that being said, I would like to thank again the Louisiana Primary Care Association, Evan Edwards, Swamak for coming out, for the support, and for just putting a stake in the sand and saying, hey, listen, we're here, right? And we're here for you, and we're going to keep pushing forward and getting through this. And we'll take any questions if there are any, but thanks again for coming out.
Mark, what's a good way for people to get connected with opioid resources?
Oh, man. So,
opioidhealthla.org.
opioidhealthla.org. Opioid, H-E-L-P. Opioid help. The microphone's picking up now. .org. Yeah. So the state is beginning to put together, they have been putting together quite a bit of resources throughout the community. I know there are other entities such as the United Way are putting together small groups of access to care points in local communities, but I would reach out to the Department of Health and Human Services and your local nonprofits.
And also texting the word opioid to 898-211 will automatically connect people to resources.
Texting the word opioid to 898-211. It's the heat, I promise. Anyway, thanks again. Yeah.
Mark, can I